member for Strathmore Brooks, followed by Grand Prairie Smoky.
Thank you, Mr. Speaker. The Strathmore Hospital is the second busiest rural hospital in Alberta, seeing over 33,000 patients a year in the emergency room alone. Despite rising populations and the broadening of their service area, the facility has not expanded to meet our community's growth. In fact, Mr. Speaker, since construction in 1985, the facility has not met the growing needs and could be putting patients at risk. Given AHS's capital plan says, and I quote, "Many of these facilities are functionally and physically obsolete." To the Minister of Health, what are you going to do to address this?
Honourable Minister.
Thank you very much, Mr. Speaker. I'll answer the first question, and my colleague may wish to supplement. Mr. Speaker, as the honourable member knows, the Strathmore Hospital redevelopment is referenced in AHS's 5-year capital plan. It is currently an unfunded project. It is one of several across the province. I am aware of the importance of Strathmore to serving not only residents in that area, but also to providing overflow for Calgary. I visited the facility myself. Mr. Speaker, we'll continue to work toward completing the necessary needs assessment for this, but as I'm sure the honourable member will appreciate, our capital dollars are limited.
Honourable member.
Well, thank you, Mr. Speaker. Given that last year the government forced the Strathmore Hospital to close the functional 25-bed unit, and given the much-needed demand for facility expansion, why is it taking the Health Minister so long to address this important issue?
Well, Mr. Speaker, that is absolutely not the case. Neither the government nor AHS forced the Strathmore Hospital to close the long-term bed unit. What happened, of course, was across the street, a brand new facility developed by the operator Aged Care opened, a state-of-the-art continuing care facility that provided state-of-the-art housing for those residents and the residents that were to follow. We call that progress, Mr. Speaker.
Honourable member.
Well, thank you, Mr. Speaker. Would this minister be willing to meet with myself, the local council, medical professionals, and AHS to address the critical need for the expanded and up-to-date facility our community requires now?
Honourable Minister.
Well, Mr. Speaker, I believe that both my colleague and myself have both visited the Strathmore Hospital. I know that I certainly have talked to the Mayor on a number of occasions, other stakeholders in the community. I believe we have a handle on the situation. As I said, we certainly understand the need, Mr. Speaker, and the desire of the community, and we will continue, Mr. Speaker, to work to do our best to make this occur. But as I said, Mr. Speaker, it's one of several projects across the province that we continue to try to complete. Thank you.